It is officially fall, y'all, and as the seasons are changing, so does our health. Many people can get off schedule, entertaining more, maybe having an extra drink or treat, and it's easy to get off your plan. So how can we take stock of our health right now and maybe make sure we have the right health plan? We have Dr. Diana Bintner joining us with True Women's Health. Always great to see you.
Thank you.
It seems like this is always such a busy time, back to school. I mean, maybe your work schedule is ramping up in the fall, and health is one of the first things that can really slide pretty easily right now.
It can, because it's hard to remember all those habits, but I think it's really important to start with your goal, because I think if people can have a sense of how it's going to be in the future, they're more likely to stay motivated when things get busy.
Yeah, when you have a goal, you can formulate the plan and make sure you adjust the plan to reach that goal. What should we be taking stock of right now, though, with our health and our habits?
Well, I think in terms of taking stock, it's like, again, what is your goal? What do you want? And people talk about, I want to be ready for Christmas, my kids come back from college, or I want to have spring break, or I want to get down on the floor and play with my grandkids. So it's really taking stock of, where do I want to be? We talk about those habits all year, but where do I want to be? And I really love to drill down into, there's 10 areas of wellness.
Okay.
So we think about, how active do you want to be? B, for body composition. What do you want your body composition to be? What is your cancer risk? I'm a list girl. You can see it goes by the alphabet here. But diabetes and metabolic health, ease of coping, phase of ovarian function. So again, it's not enough to know your numbers, your cholesterol, but what actually are these areas of health that we can break it down into? Yeah,
I mean, these are several different areas. Should we start with one? I mean, is that the best place to start?
I guess it's what matters most to you, right? So a lot of people will say, I'm having hot flashes, my phase of ovarian function is important. Or my body composition, I really don't like how I'm fitting into my fall clothes. I want to look at, what is my body fat? What is my muscle mass? It's not enough to know your weight. What is your muscle mass?
Yeah.
Or someone might have a friend with a recent cancer diagnosis. I don't want to have cancer, so okay, it's time to really focus on, what is my risk for cancer? If it doesn't mean something to us, it's hard to make a plan and stay motivated, right? So it needs to be something that's meaningful.
Right, and easy to kind of start, maybe with one goal as opposed to like having 5. You're more likely to stick to the plan if it's more attainable, right?
Exactly.
Let's talk about Jane.
So Jane had a busy summer, kids, busy cottage, barbecues, all the things. And so she's like, I really need to get back organized. And she knew all her numbers. She had her cholesterol, she had her sugar, but yet she didn't know what to do with those numbers. So we said, okay, let's start with the basics. What do you want? Okay, spring break. I want to be fit and confident for spring break. Okay, so we started with her ability to be active. She had hip pain, couldn't work out. Let's get into PT. What's your barrier? Let's get into PT.
Right.
So we went through all her different areas of wellness, and she left with a plan. And now, okay, I am motivated to drink my water and stretch. Those were her big things she was going to start with. And so, again, she left with a plan. It's more than just knowing your numbers. What do you do with those numbers?
Yeah, got to have a plan. Takeaway tip for us this week.
Takeaway tip is, I want everyone to write down their goal. What do you want and why? Again, get down on the floor with your grandkids, be active on spring break, but take a minute, write down that goal, put it on the bathroom mirror, that's why I'm doing what I'm doing.
Yeah, great to talk about this now, and great to start now, because the holidays are coming, and we know that can derail a lot of plans. All right, thanks so much.
Thank you.
Dr. Bintner, appreciate it. We'll be right back after this.